My name is Rob Lawrence. I'm Dr. Lawrence, and I have a particular interest in the natural healing approaches to digestive disorders, including IBS. I am a chiropractic physician and a board-certified clinical nutritionist. I am not a professional speaker, so bear with me as I describe what I do. I'm a nutrition advisor associated with Jordan Rubin's company, Garden of Life, one of the largest whole food vitamin manufacturers in the country. In that capacity, I speak regularly with many practitioners across the country, advising them on how to care for the digestive health of their patients. I have also helped hundreds of patients locally regain normal digestive health, and I can help you too. So sit back and relax, and let's get started on helping you find the relief you're looking for. An estimated 40 million Americans suffer with IBS. Some experts, recognizing that many go undiagnosed, suggest that IBS affects approximately 10 to 20% of the general population. IBS is characterized by a group of symptoms in which abdominal pain or discomfort is associated with a change in bowel pattern, such as loose stools like diarrhea, and or hard or frequent bowel movements or constipation. We know that gender plays a clear role, as more than 80% of IBS patients are women between 20 and 55 years old. The criteria for diagnosing IBS is based on the presence for at least 3 months of the preceding 12 months of abdominal discomfort or pain that cannot be explained by a structural or biochemical abnormality. In addition, pain is relieved with a bowel movement. There is a change in the frequency of bowel movements, multiple movements daily or constipation for many days. And there is a change in the form of the stool, such as loose, watery, or pellet-like. Some people with IBS have constipation, which we call IBS-C. Some have diarrhea, which is IBS-D. And some alternate back and forth between constipation and diarrhea, IBS-A. IBS symptoms result from what appears to be a disturbance in the communication between the intestines and the portion of the nervous system that controls intestinal speed and sensation. Research suggests that the cause of IBS is related to an abnormal change in the hormones produced by the brain and the digestive tract. This imbalance can also involve the immune system. The communication between the brain and the gut, which is commonly called the second brain, is largely controlled by the messenger hormone known as serotonin. The brain and gut have serotonin landing sites that regulate the perception of intestinal pain and contractions that move food through the intestinal tract. 90% of serotonin receptors are in the intestinal tract. Research suggests that IBS patients have extra sensitive pain receptors in the GI tract, which may be related to low levels of serotonin. Because serotonin also is involved in mood, decreased levels of serotonin may help explain why people with IBS are also likely to be anxious or depressed. Studies show that up to 1/2 of IBS patients meet the diagnostic criteria for depression, anxiety, or panic disorder. It also explains why those with IBS have flare-ups when they get under too much stress. Restoring optimal levels of serotonin has been the focus of traditional drug therapy. Zelnorm is one of those drugs that was marketed as a treatment for IBS constipation, as it acted on the receptors for serotonin. It has recently been pulled from the market for its association with heart attacks and stroke. Even before this drug was recalled for cardiovascular risk, many experts warned that this drug was dangerous for its other potential side effects, including liver and kidney impairment, bowel obstruction, diarrhea, constipation, abdominal pain, headaches, adhesions, gallbladder disease, and back pain. Lotrinex is another drug prescribed for IBS diarrhea. Within 8 months of being on the market, reports of a life-threatening condition, ischemic colitis, began to be received. Lotrinex was responsible for at least 4 deaths, possibly many more. Many who took the drug reported severe abdominal pain from constipation. The drug was taken off the market temporarily and is now back, but with stricter prescribing guidelines. Antispasmodic drugs, Levsin, Levsinex, Bentyl, and Donatol, are routinely prescribed for the treatment of IBS symptoms. There are a number of side effects associated with these and any other medication. Potential side effects include bloating, constipation, dizziness, dry mouth, nausea, and many more. Using potentially dangerous drugs to reduce symptoms while ignoring natural and often more effective approaches is typical of what is wrong with cookbook symptom-focused medicine. Reversing IBS with nutritional, metabolic, and neurological therapy is the approach that I use in my practice. I find that IBS symptoms usually disappear or are greatly reduced once we correct poor eating habits, uncover any hidden allergies when present, including gluten intolerance, when we boost optimal stress coping chemicals such as serotonin, magnesium, and B vitamins, and when we restore bowel ecology in the form of probiotics and take the right digestive enzymes. It is possible to boost serotonin levels in the body using the amino acid that the body uses to make serotonin, 5-hydroxytryptophan, or 5-HTP. 5-HTP, along with the right vitamins and minerals, is responsible for making serotonin in your body. If you have IBS, you may benefit from taking 300 to 400 milligrams a day with food. Most digestion and absorption takes place in the small intestine and is regulated by digestive enzymes from the pancreas and bile from the liver. The pancreas aids in digestion by releasing enzymes which help break down proteins into amino acids. Natural digestive enzymes are found in raw fruits and vegetables. Processed foods are usually devoid of digestive enzymes. Overconsumption of processed foods can lead to digestive enzyme deficiencies. This may then lead to poor absorption of food and/or a condition called intestinal permeability, where the intestinal lining is disrupted and the immune system starts reacting to the food you eat. To ensure proper digestion and absorption, I recommend taking digestive enzymes with each meal. I always recommend people take a quality whole food multivitamin mineral formula. Patients with IBS have depleted their stress coping chemicals, serotonin, magnesium, and vitamins. And this not only leads to IBS, but also prevents them from overcoming IBS. It's a vicious cycle that can only be broken by taking adequate amounts of essential vitamins, minerals, and other nutrients. I've already mentioned earlier the mineral magnesium, which is involved in over 300 bodily processes. It is particularly important for reversing the symptoms of IBS-C and IBS-A. Magnesium helps relax the smooth muscle of the colon, acting like a natural laxative. While a diet high in nutritious fiber is important, magnesium is even more important. A magnesium deficiency not only causes constipation, but can also lead to heart disease, mitral valve prolapse, depression, anxiety, chronic muscle pain, headaches, fatigue, and many other unwanted health conditions. Those with IBS-C may go up to 1,000 milligrams of magnesium each day, while those with IBS-D may need less than 500 milligrams. I recommend patients begin with 500 milligrams of magnesium a day, preferably taken in a multivitamin formula. The human intestines are inhabited by billions of beneficial and harmful bacteria and other organisms. The beneficial bacteria, which are mostly located in the colon or large intestine, aid in digestion by fermenting substances that were not digested in the small intestine and by breaking down any remaining nutrients. A healthy intestinal tract contains some 2 to 3 pounds of bacteria and other microorganisms, such as yeast, that normally don't cause any health problems. It is absurd to suggest that individuals with IBS have a drug deficiency. IBS is not a disease. It's a symptom of a compromised GI system. When the intestinal tract is repeatedly exposed to toxic substances, such as antibiotics, steroids, and other drugs, the harmful microorganisms begin to grow in numbers and create an imbalance in the bowel flora. Harmful organisms like yeast and some normally dormant bacteria begin to overwhelm the good bacteria. This condition is known as intestinal dysbiosis. To aid in digestion and prevent intestinal dysbiosis, patients with IBS should take probiotics on a daily basis. These are beneficial intestinal bacteria that include lactobacillus and bifidobacterium. I recommend taking high doses of probiotics 3 times a day on an empty stomach for 2 to 3 months. This approach isn't for everyone. However, in the majority of my patients, their IBS symptoms are usually reduced. The next thing we do is look for other triggers of IBS and other GI problems like allergies. Allergy symptoms are the body's way of announcing an immune reaction to something in your environment that is potentially harmful to you. The symptoms range from a simple runny nose and itchy eyes, like hay fever, to a life-threatening throat closure called anaphylaxis. Some other signs of allergy can be hidden and not so obvious. This could include digestive upset, heartburn, fatigue after meals, diarrhea, constipation, bloating, and excessive gas. Many people who have symptoms of IBS may in fact be suffering from food-related immune reactions. A simple blood test can help identify foods you're sensitive to. Eliminating those foods from your diet can provide almost instantaneous relief.